Spring has come to the Northwest. Numbers of cases and hospitalizations continue to fall.
Multnomah County Health Officer Dr. Jennifer Vines has been one of the most trusted voices throughout the pandemic. So we're turning to her for some perspective ahead of the mask mandate ending at 11:59 Friday night.
I actually have a sense of optimism. I think this is a great milestone.
It's a milestone that Dr. Vines says people will approach differently. Some, she says, will shed the masks immediately. Others will not.
I think we all need to be patient and expect to see people still in masks because they choose to be, or because they feel they need to be for their own health risks, or because they are taking some steps to protect others that they feel they need to take.
Some of the others who may need a little extra protection are those children under 5 who are too young to be vaccinated. It begs the question, should they, and even older kids, continue wearing masks in public and in schools that don't require them? Or is it safe to drop masks altogether? Dr. Vines won't say either way, but she will say this.
As cases continue to get lower and lower, the risk of those gatherings and of those social interactions only gets lower and lower. So the notion of masking in case someone around your child has the virus, just that possibility from a risk standpoint, from just a pure numbers standpoint, is going to get lower and lower.
I'm hopeful.
Dr. Katie Scharf is the chief of infectious disease at Kaiser Permanente. She says regardless of your decision to ditch the mask or continue wearing it, we all must remain vigilant.
If cases do rise or a new variant comes that is more severe, more transmissible, or evades immunity, that we need to be dynamic enough to pivot if the masks have to go back on.
If that need arises, it's Dr. Vines' belief that it won't happen until fall, when respiratory viruses circulate with more ease and people head indoors. Until then,
I think my final words to people are for people to take the time they need to take their masks off, that I fully support anyone who wants to continue masking.
All right, something else Dr. Vines supports is acknowledging the next step in all of this. That is taking a moment to focus on healing, being together, and reconnecting after a long 2 years. Ashley?
All right.